Today it's about shoulder pain. And always remember to drape properly. We start by warming up the area and applying the oil. Let's first check the range of motion on the injured side as well as the other side. Look for any anomalies. By rotating the arm, you can get a better understanding of the anomaly or not. It's all about the palpation or how it feels. Cross-fiber friction can be applied in a transverse direction across muscle, even the tendons and ligaments. We start the treatment by working the distal edge of the rhomboid major and minor at the spinous process of cervical T1 and C6. I will distract, then push. Distract and push. Always rechecking to see if there's a change. Now that you have worked the injury, let's rotate, palpate, and see if there's more to do. Now we are working close to the scapula, towards the spine. Same as before, distract and push. It's all about the origins and insertion. Work the area, checking, palpating to see if there are changes. Now you have done your treatment. Verify with your patient that it has responded. Today in part 2, it's all about stretching. Now in the first one, it was about repair. This is about simple stretching. I have the patient's right arm folded into his back to expose the scapula. If there's a problem with that and there's distress, just lower the hand on the patient's hip. Now, even with stretching, you'll want to make sure that you palpate to make sure you're getting results. I am using my left hand to stabilize his right hand. Now I'm going to use the elbow in a form of lomi-lomi. I'm going to use my left hand to once again take the patient's right hand and distract, stretch it out while I make the move with my elbow. Always stay in communication with your patient. And a simple rotation, and you can stretch the entire quadrant. You too can learn, live, be healthy.